Imagine an inherited disease that slowly, relentlessly steals your sight, starting with the dark and then eventually taking the light completely. For decades, there's been no cure. But, that might be about to change. Okay, let's dive into this truly groundbreaking gene therapy that's offering real, tangible hope to people who have lost almost all of their vision. So, to really get why this is such a big deal, you have to understand the scale of the problem. We're talking about an estimated 1.5 million people all around the globe who are affected by these rare genetic eye diseases. That is a huge number for a condition most people have never even heard of.
All right, so the specific condition we're going to zero in on today is called retinitis pigmentosa, or RP for short. And this isn't just one single disease, it's actually a whole family of them, and they all, unfortunately, share the same devastating outcome.
So, what's actually happening inside the eye? Well, think of your retina like the film in an old-school camera. It's covered in these amazing light-sensing cells called photoreceptors. With retinitis pigmentosa, the genetic code that's supposed to keep these cells working is faulty. So over time, they just break down and die off. For patients, the progression is just heartbreakingly predictable. It usually kicks off with trouble seeing at night. Then, their field of vision starts to close in, creating this tunnel effect, and colors begin to fade. And eventually, even that tiny tunnel of central vision can be lost, leading to total blindness. For the longest time, the options for these patients have been, incredibly limited. Doctors could help manage some symptoms, but they couldn't actually stop the disease from marching forward. And that's exactly why the search for a new approach has been so incredibly urgent. Then, a few years ago, we had a major breakthrough, a gene therapy called Luxturna. It was the very first of its kind to get the green light from the FDA for RP. And it was huge because it proved that yes, the concept of gene therapy could actually work to restore some vision. But, and this is a big but, Luxturna has a major catch. It only works for patients who have one very specific gene mutation called RPE65. And this mutation, it accounts for less than 1% of all RP cases. So the vast majority of patients were just left out. This is where this new approach, MCO-0010, is a complete game changer. It's designed to work no matter which gene is causing the problem.
So, how on earth does it do that? Well, the science behind MCO-0010 is really cool. It uses a fascinating technique that basically sidesteps the genetic problem entirely and builds a whole new way for the eye to see. It's all based on a field called optogenetics. And the core idea is it's brilliant. You see, even after those main light-sensing photoreceptor cells die off, a lot of other cells in the retina are still there. They survive. This therapy basically gives those surviving cells a brand new job. It turns them into new light-sensing cells.
And for the patient, getting the treatment is remarkably simple. It's a one-time injection into the eye. A harmless, modified virus acts like a tiny little delivery truck, carrying the genetic code for a special light-sensing molecule. And one of the best parts? Unlike some earlier attempts at this kind of tech, patients don't need any special goggles or high-tech devices to make it work.
So let's just pause on this for a second, because this is the most important part. Because the therapy isn't trying to fix one specific broken gene, but is instead building a totally new system from the ground up. It doesn't matter which gene mutation caused the blindness to begin with. This mutation-agnostic approach, it's a fundamental shift in how we think about treating genetic diseases.
Okay, I know, this all sounds incredible in theory, but the big question is, does it actually work in people? Well, the results from the clinical trial are where this story gets really, really exciting.
The lead researcher, Dr. Alan Ho, really put it perfectly. He said, "We are finally on the brink of an impactful therapy for people with severe vision loss. These findings finally deliver hope." I mean, you can just feel the weight of that statement after so many years of work.
So, what did they find? Get this, in a proper randomized controlled trial with patients who had severe vision loss, we're talking people who could maybe only see a hand moving in front of them, up to half of those who got the treatment responded. A 50% response rate in this group is, as the doctor said, surprisingly strong.
And for the people who did respond, the improvement wasn't small. On average, they gained 3 lines of vision on a standard eye chart.
So what does that really mean, gaining 3 lines? It can mean going from only being able to tell if a hand is moving in front of your face to actually being able to read the big E on an eye chart. For someone living in near total darkness, that is an absolutely life-changing improvement.
This is a massive step forward, for sure, but it's not the end of the journey. So, what's next? where does this incredible therapy go from here?
Well, the timeline is moving fast. The full results were just presented. The company is planning to submit their application to the FDA in early 2025. And they're not stopping there. They're already planning more trials for another type of genetic blindness called Stargardt disease.
And there's even more good news. The FDA has given this therapy a fast-track designation. Now, this is a big deal. It means the agency sees its potential to treat a really serious condition and is going to help speed up the review process to get it to patients as quickly as possible.
And all of this brings us to the biggest question of all. We've just seen a therapy that can bypass the specific genetic flaws to restore sight. So, could this way of thinking, this mutation-agnostic paradigm shift, could it be the key that unlocks treatments not just for more RP patients, but for a whole range of other inherited diseases that cause blindness? For the very first time, the answer looks like it could be a resounding yes.